पैरालिसिस एक ऐसी स्थिति है जिसमें शरीर के किसी भी अंग पर या फिर एक से ज़्यादा अंग पर आपके कार्य की क्षमता या उसकी गति धीमी हो सकती है या नष्ट हो सकती है। ये आपके ब्रेन के डिसफंक्शनिंग या फिर नर्वस सिस्टम के डिसफंक्शनिंग की वजह से हो सकती है। कुछ ऐसी हर्ब्स हैं जिनके इस्तेमाल से आपके उपचार में मदद हो सकती है, लेकिन यह सीमित ही रह सकती है। ऐसी हर्ब्स जो आपके ब्रेन की फंक्शनिंग को इम्प्रूव करती हैं, साथ साथ आपके नर्वस सिस्टम को स्ट्रेंथ प्रोवाइड करती है, जिससे आपके शरीर के अंग में इम्प्रूवमेंट आती है और बैलेंस क्रिएट होता है। सबसे पहले आती है शंख पुष्पी। शंख पुष्पी आपके ब्रेन के ब्लड सर्कुलेशन को इम्प्रूव करती है, उसको एनहांस करके आपके नर्वस सिस्टम को भी इम्प्रूव करती है, जिससे शरीर के किसी भी वीक लिम्ब पर रिकवरी होने के चांसेस बढ़ जाते हैं। नेक्स्ट है पारिजात। पारिजात के फूलों का सेवन किया जा सकता है या इसका अर्क भी इस्तेमाल किया जा सकता है। पारिजात भी आपके शरीर के लिम्स अफेक्टेड एरियाज पर आपके ब्लड सर्कुलेशन को इम्प्रूव करता है और बैलेंस और उसको स्ट्रेंथ प्रोवाइड करता है, जिससे आपके पैरालिसिस से इफेक्टेड बॉडी पार्ट को रिकवर करने में मदद मिलती है। इसके बाद आती है ब्राह्मी। ब्राह्मी एक मेध्यवर्धक वटी है जो हमारे ब्रेन के लिए या ब्रेन फंक्शनिंग को इम्प्रूव के लिए इस्तेमाल की जाती है। ये आपके शरीर के डेड सेल्स को रीजनरेट करती है और आपके अंगों को वापस से रिकवर करने में मदद करती है। आप इसका इस्तेमाल इसके रस को निकाल कर सकते हैं या फिर इसके पाउडर को लेकर कर सकते हैं। आप इसके पाउडर को दूध में मिलाकर इसका सेवन कर सकते हैं। इसके बाद आता है अश्वगंधा। अश्वगंधा आपके न्यूरॉन्स को इम्प्रूव करता है, आपके नर्वस सिस्टम को स्ट्रेंथ प्रोवाइड करता है। साथ साथ में ये आपकी मसल्स को भी स्ट्रेंथ प्रोवाइड करता है और मसल्स की फंक्शनिंग को भी इम्प्रूव करता है, जिससे आपकी रिकवरी फेज को इम्प्रूवमेंट मिलती है और आप जल्दी रिकवर कर सकते हैं। इसका इस्तेमाल पाउडर के रूप में किया जा सकता है। आप इसके पाउडर को दूध में मिलाकर सुबह और शाम सेवन कर सकते हैं। इसके बाद आती है गिंको बिलोबा। यह हर्ब आपके बॉडी के सभी बॉडी पार्ट्स में ब्लड सर्कुलेशन को इम्प्रूव करती है, साथ साथ में नर्वस सिस्टम को भी इम्प्रूव करती है। पैरालिसिस के कारण अफेक्टेड हुए ऑर्गन्स पर या फिर बॉडी पार्ट्स पर जो कमजोरी आ जाती है, यह वहाँ के ब्लड सर्कुलेशन को इन्हांस करती है, जिसकी वजह से आपको रिकवरी करने में मदद मिलती है। आप इसका इस्तेमाल इसके पत्तियों का रस निकाल कर सकते हैं या फिर सूखी पत्तियों की चाय बनाकर भी कर सकते हैं। आप इसका इस्तेमाल पाउडर के फॉर्म में भी कर सकते हैं।
We will be doing some yoga poses for paralysis. While these postures can directly cure paralysis, they may aid in rehabilitation, increase mobility, and offer support for overall well-being. First is Tiryak Tadasana. Stand with your feet together, arms at your side and spine straight. Inhale deeply, raise both arms overhead and join your palms together. Keep your body tall and gently lean to the right side, stretching the left side of your body while keeping your legs straight and feet grounded. Hold for a few seconds, breathe deeply and feel the stretch. Return to center and repeat the movement on the left side. Perform this cycle 5 to 10 times on each side. It helps to stretch and strengthen the muscles in the torso, which aid in preventing stiffness or atrophy in the body. Gentle side stretches may increase blood flow, especially to areas with reduced movement. It enhances coordination, which is important for rebuilding lost motor functions. Even if the person cannot stand, performing this pose while seated can help maintain balance and improve body posture. Now we will be doing Setubandha Asana. For that, lie on your back with your knees bent and feet flat on the floor, little bit apart. Place your arms at your side and try to catch your ankle. If it is not possible, then keep your palms facing down on the ground. Press your feet into the floor and on an inhale, lift your hips off the ground, creating a bridge shape with your body. Keep your thighs parallel to each other and try to lift your chest towards your chin. Hold the position for 15 to 30 seconds, breathing deeply. This pose can help activate and strengthen the gluteal muscles, lower back and legs, which are critical areas for individuals with paralysis. By engaging the spine and the core, it can help stimulate the nervous system and encourage communication between brain and the body. A gentle back bend can open up the chest and enhance circulation, which may help in preventing complications like blood clots and poor circulation in paralyzed area. To release this pose, slowly lower your hip back to the floor. Now we will be doing Pavan Mukta Asana. Lie on your back with your legs stretched out and arms by your sides. Inhale and bend your knees towards your chest. Hug your knee with your arms, pulling them tightly to your chest. Hold the position for a few seconds, then exhale and come back. You can perform this with single leg first and then from both the legs together. Repeat this for 5 to 10 times. This pose promotes movement and flexibility in the spine and lower body, which can help with reducing stiffness and improving joint mobility. Also, engaging the abdominal muscles can gently activate them, which is essential for overall movement and function. It can help alleviate digestive problems that are common in individuals with paralysis due to limited movement. Now we will be doing Bhujangasana. For that, lie on your stomach with your legs extended and feet together, pressing into the floor. Place your hands by the side of your chest with your elbows close to your body. Inhale and slowly lift your chest by straightening your arms while keeping your elbows slightly bent. Keep your pelvis grounded, gently arc your back and tilt your head back. Hold this position for 15 to 30 seconds, then gently come back with exhalation. It enhances lower back, shoulders and arms strength for daily activities. Spinal extension activates nerve endings, aiding those with limited movements. Chest opening boosts lung function and breathing. It also reduces stress and anxiety, improving emotional well-being.
Today we are going to discuss about the topic known as paralysis, or otherwise known in Ayurveda as Pakshaghata. So what is Pakshaghata? Pakshaghata, as in Ayurveda, it is known as Paksha means one side and Aghata is impairment or the disability. So when and why Pakshaghata occur? So there are different notions or opinions about Pakshaghata because it can occur due to so many conditions. The most commonly in brain, where is that infarct or the blood clot, and that actually affects the nervous system of the one side of the brain. That is when the clot or embolism occurs in the one side. If it is occurring in the right side of the brain, the left side gets paralyzed or that is impaired or disabled. And when a clot occurs in the left side, the right side of the upper and lower limbs gets impaired or disabled. So basically this is a common notion which I think most of us know. But we need to go, why does the clot happens? Then we need to go into that. Because as you know, the blood pressure or the Raktamarda occurs due to various factors, especially it could be hereditary or it could be due to various stress factors. This is where many of the people, especially in the modern times, we overlook because stress is now a major factor in so many diseases, including Pakshaghata. So what I'm saying is that this is a factor which affects the brain because due to the blood pressure or the Raktamarda, tiny blood vessels break and that blood clot happens and then it affects the brain and thereby it happens. So what I'm saying is that we have overall view about why this happens. So when we say that Pakshaghata is occurring on one side of the body, there is loss of movement due to the impairment of the nerves, and also about the muscles and the connective tissues and also the bones, especially in the upper and lower limbs. So we need to improve the coordination of the brain with the upper and lower limbs through the nerves and muscles. So that is how Pakshaghata has to be improved through various methods and techniques. In Pakshaghata, we have as effective treatment in Ayurveda through the Panchakarma therapies. Also, at Vaidyaratnam Vrindavan Ayurveda Chikitsalayam. So we have taken a step forward along with various treatments as well as in Panchakarma. We also are in combination doing effective treatment for the patients afflicted with Pakshaghata with physiotherapy, because as we at Vaidyaratnam Vrindavan Ayurveda Chikitsalayam always have an effective method of treatments, and we always looking forward to various effective treatments. So we want the patients to have effective and quality life, so that we are not specified to any kind of system or treatment. In Pakshaghata, the diet is also very important, because paralysis patients, symptoms will be that there will be a lot of weakness and muscle degeneration, also muscle wasting can happen in later stages. So we have to be careful regarding the protein improvement of the particular patient, especially for improvement of the nervous function and muscular functions, and also improving the bones. So these are the things which we need to be very careful about in a diet for Pakshaghata patients. So especially when we say the diet, we have to concentrate on the dhanya, that is especially green grams, or even the sprouts would be very much effective. But we should avoid certain dhanya like rajma, chole, or even peanut and all that. It should be avoided, because those kind of things are dry and also very difficult to digest, and also it can cause indigestion and also constipation. So especially easily digestible foods should also be preferred, and also high in proteins, so that improvement in muscles and nerves occur in a much faster rate. So also we can concentrate on the multigrain atta, especially North India. Atta and also those kind of foods are preferred. So especially atta, we have to add millets, jowar, and also like ragi, and that is very effective in digestion and improving the musculature of the particular patient. We also can give milk and milk products, which also are high in proteins. And also if the patient can take non-veg, non-vegetarian patients can take egg white, and also to an extent the milk products are also effective for such people, so that it will improve the muscle tone as well as the mobility of that patient. And also we should always insist on the patient to drink lots of water, but not cold and refrigerated drinks. That actually hinders the digestion. So we have to concentrate on jeera or saunf added water to be boiled, and that kind of water should be given. And also there are, I would say, avoiding oily foods or the fried items and the mirch masala items. All those should be avoided, so that it will not be effective, and in fact it will be detrimental for the improvement of the patient. So such kind of food should also be avoided. And also especially sugar, because in many other patients along with paralysis, they can also be affected with diabetes or any other things, like even hypertension. As I said, hypertension is one of the factors, causative factor of the paralysis or Pakshaghata itself. So salt intake also should be regulated, and also the sugar. So white sugar and white salt should be avoided, and I would personally prefer Saindhav namak, that is the Saindhav salt. Instead of white sugar, I would prefer jaggery, those kind of natural kind of sugar, rather than the white sugar, because actually that also can hinder the digestion and also the improvement of the patient. So these are some of the diet which can be looked upon. Or
Namaskar. Now we will talk about the management of Pakshaghata through Ayurveda Panchakarma treatments. According to Acharya Charak, Chikitsa Sutra of Pakshaghata is Swedanam Sneh Sayuktam Pakshaghate Virechanam. And according to Acharya Shushrut, the line of management of Pakshaghata includes Snehanam, Swedanam and Mridu Virechan. And according to Acharya Vagbhat, he includes Snigdha Virechan. Initially, Snehan and Swedana are to be provided, and that should be followed by the Mridu Virechan. Virechan is recommended in Ayurvedic texts as the key treatment of Pakshaghata due to its ability to pacify the vitiated Vata Dosha. Virechana brings Vata Dosha in normalcy. The main samprapti or pathology of Pakshaghata takes place in Mastishka, that is the mental and physical impairment to the patient. So, Buddhi Prasadan and Dhatu Sthirtav are the main benefits of Virechan Karma. Then after, Basti Chikitsa should be administered, and it is of two types, Anuvasan Basti or Asthapan Basti. So, Basti Chikitsa is considered as Ardha Chikitsa by Acharya Charak. In the pathology or samprapti of Pakshaghata, Vata is the Pradhan dosha which is involved in this disease. So, Basti is a prime line of treatment for Vata dosha. Basti is not only treatment for Vata disorder, but it is also equally effective in correcting the morbid Pitta and Kapha dosha. Asthapan Basti, the Rajapan Basti or the Shmula Shir Basti should be given in Niram condition, and in Am condition Lekhana Basti should be administered, and then after Shiro Basti, Shirodhara, Shiro Pichu, Shiro Lepa and Nasyam should be administered. These treatments ultimately affect on the functions of central nervous system and definitely benefits for the paralytic patient.
So today we will discuss about physiotherapy rehabilitation in paralysis. So here is our patient. First we do passive range of motion exercises. Her left side is paralyzed, upper limb as well as lower limb. So first we do passive range of motion exercises. First we move wrist, extension, flexion, extension, flexion. 10 to 15 repetitions, finger movements. Then we come to elbow joint, elbow movement, flexion, elbow extension. We give elbow stretch also, flexor, elbow flexor muscle stretch. Hold for 30 seconds, 3 stretch, flexion, extension, internal and external rotation. Shoulder range of motion exercises. Hold the joint and move the shoulder. 10 to 15 reps. Then shoulder, abduction, 10 to 15 reps. Basically, we have to break flexion synergy that has happened due to paralysis. We have to break this synergy pattern with opposite extension movements of finger, wrist and elbow and abduction of shoulder. Then we come to lower limb, ankle toe movements, 15 to 20 reps, knee bending, 10 to 15 reps, hip flexion, 10 to 15 reps, hip flexion, hip abduction, these are basic passive range of motion exercises. Then we come to stretching. Stretching of lower limb muscle. First is hamstring. Person will feel stretch over here. 30-second hold, 3 stretch. Calf muscle stretching. 30-second hold, 3 stretch for calf muscle. Person will feel stretch over here, gluteal muscles. And then piriformis stretch. 30-second hold, 3 stretch. Adductor stretching. Person will feel stretch over here. 30-second hold, 3 stretch. Then again ankle toe movements and then bridging. This is our stretching protocol. Then we come to strengthening. 10-second hold, 5 reps. Strengthening of pelvic muscles. Pelvic rolling. 10 on each side, 10 on right, 10 on left. Then positioning of the patient. Side turning of patient. Lying to sitting position. So her left side is paralyzed. Posture straight. Patient will have to maintain her posture also. Now standing, then sitting. 10 times. Then again standing, sitting. Now walking, walk and gait training. We assist the patient to help her walk. So this is the parallel bar. This we use in gait training of paralysis patient. And the mirror is used for maintaining the posture of the patient. Ask the patient to sit for 10 to 15 seconds. Then we ask the patient to stand. Ten repetitions. So now we place muscle stimulator to the patient. This machine helps in stimulating the muscles which are paralyzed. So we place the electrodes on the motor points. We set the frequency of the machine and patient will feel minor minimal contractions. The time duration of the machine is 15 minutes and 90 contractions.